The nays are 215. The bill is passed.
Democrats cheer the House passage of a health care reform bill while the president looks to the Senate to close the deal. For millions of people, it's going to cost more to have health insurance next year. That's because your employer is scaling back on health care coverage. You probably know that, leaving you responsible for more of the tab. CNN's Lisa Sylvester has details.
For many U.S. workers, it's open enrollment time when workers choose their company-sponsored health care plans for next year. What they are finding, many corporations have scaled back. Workers will have to pay higher out-of-pocket costs. According to a September survey by Watson Wyatt, a company that advises corporations on benefit plans, 4 out of 10 employers are raising workers' deductibles and co-payments next year.
Healthcare costs are still rising faster than pay, rising faster than profits. They're rising faster than almost any other input. And so those costs have to be shared, and one way to do that is to increase the out-of-pocket costs for people who use healthcare services.
Congress is debating a healthcare bill, but will it push down those rising costs that workers have to shell out? Democrats think so.
This is why this legislation is important. Affordability for our middle class. It lowers cost for every patient, reins in premiums, co-pays, and deductibles, limits out-of-pocket costs.
But many Americans are not persuaded that President Obama's health care plan will put the brakes on rising premiums. According to a September CNN opinion research poll, 47% of Americans believe the president's health care plan will increase medical costs. Only 16% say it will decrease costs. The Cato Institute, a libertarian think tank, says if insurance companies have to provide coverage to those with pre-existing conditions or those who are currently denied insurance, that will inevitably push up costs.
They're attracting more sick people into the new exchanges. They are giving healthy people every incentive not to purchase health insurance at all. And when you only have sicker people in the pool and the healthy people are leaving, that means premiums are going to go up for everyone who remains.
Especially if healthier individuals opt to simply pay fines rather than pay higher amounts for health insurance. Lisa Sylvester, CNN, Washington.